Nerve 2 is the optic nerve. This functions to provide us vision. Information passes from the retina down to the brain. The anatomy of the optic nerve is that it connects directly to the diencephalon, and it is part of the central nervous system. Axons from the neurons in the retina travel through cranial nerve 2 to the visual pathway. This is a diagram of how our input goes from the eyeball. It comes down through the retina at the back of the eyeball, down to optic nerve 2. It then crosses at the optic chiasma, and then goes through the optic tract to the lateral geniculate nucleus of the thalamus. From there, our brain interprets the information. The visual pathway, where the cells begin in the retina, light is converted here into neural signals. Signals are processed in the retina and then are conveyed into retinal output cells. These signals converge at the optic chiasm, then they synapse at the thalamus. Your signals here are afferent, which are sensory impulses. This is an image of the visual pathway. You can just see again how it crosses over at the optic chiasm and moves down through the thalamus to the back of the brain. The functions of your optic nerve is to convey visual information to other areas of your brain. It carries impulses formed by the retina. It controls visual processing, such as location and recognition of objects, and it does that through the sensation of light. The brain interprets this light as images. This is the foundation of how we see. The images and the light go into our eyes, travel back, and the brain interprets it and decides that's a ball or that's a car. This is kind of how we process the information. Our nerve layer senses that light, and it creates an impulse. There's a primary visual cortex, which determines the shape, size, and texture of the object. Our secondary visual cortex is what determines color and motion. All of these things are how we determine what we are looking at in our daily lives. Our input is then directed to the cerebral cortex, where the brain works to identify the object. Here presenting pathology from Cranial Nerve 2, some of the different pathologies you'll see, and the most common are lesions of the optic chiasm. One of the most common one there is called a bitemporal hemianopia, which is when you lose your visual field bilaterally. You also have retrobulbar neuropathy. Retrobulbar neuropathy is when your vision diminishes due to demyelination, and it actually diminishes very quickly. You can have significant pain and tenderness due to pressure in this neuropathy. Scotomas are a result also of demyelinative diseases, something like MS. It could also be from toxins, nutritional deficiencies, or vascular disease. The atrophy here is at the optic disc and results in a defective light reflex. And again, that light is how you are sending signals to your brain to be interpreted as images. And then finally, there's macular degeneration, which is a degeneration of the retinal pigmented epithelium. It actually results in almost an immediate loss of vision. You can, however, retain peripheral vision, but that is also slowly lost over time. The last one is anopia, and that is an ipsilateral blindness due to sensory loss of the nerve.
So for clinical testing of the optic nerve, there are 4 that we're going through. So there's visual acuity, visual fields testing, color vision testing, and pupillary reflexes. So for visual acuity, it's testing the integrity of the eye using a Snellen chart, which is displayed here. A decrease in visual acuity could be a potential cause from retinal diseases such as age-related macular degeneration and optic neuritis. And to perform this, which we will demonstrate after, you have the patient stand 6 meters from the Snellen chart, and you have them just read down the list to the lowest line that they can read. You can test this with one eye shut and perform it on both eyes, or you can do it with both eyes open, and you just record the line that they read down. For visual fields testing, we'll have this demonstrated as well. It's just an optic field testing. So you're having the patient look into your own eyes as you place your fingers up in different quadrants, and they're basically looking for where they see a finger moving, and that's just testing their visual field and their periphery. For the color vision test, this is an Ishihara test. So it's for color blindness, and it also is for optic neuritis. This is testing for red or green color blindness, and you're just distinguishing the number in the center. For pupillary light responses, this is for a direct pupillary reflex. So the afferent is the Cranial Nerve 2, and efferent is the Cranial Nerve 3. So it's best to do in a dimly lit room, and you're just shining a light into their eye, and you're looking for the pupil constriction. It's if it's sluggish or slow, or there's a lack of constriction in the pupils, it could be a pathology from an optic nerve, brainstem, or just the use of certain drugs. So we're going to demonstrate the visual acuity and the visual fields testing, as well as the pupillary reflex. So if you have your patient, they're just going to be sitting, standing 6 meters away from a Snellen chart. You can have them covering one eye or just using both eyes. So if you want to just go ahead and read down the chart.
E, F, P, T, O, Z.
Perfect. And you're just going to record as low down as they can go. And make sure if you're going to do one eye, check the other one as well. For the visual field testing, so you're going to have the patient just look into your eye, and I'm going to have my hands up, and just tell me where you see the fingers moving. Good. And that's just checking her periphery and the fields. So then for the light constriction, you're just going to check into their eyes. Good. Good. And that's just testing the constriction of their pupils.
We're all set. Hope you enjoyed the video on Optic Nerve 2.